Each year, nearly 70,000 adolescents and young adults, often referred to as AYAs, are diagnosed with cancer in the U.S., a diagnosis that brings with it the potential to disrupt social growth and achievement of developmental milestones. These disruptions often occur due to the interplay of physiological factors like pain, fatigue, and change to physical appearance with psychological factors such as depression and anxiety. These issues play out in the individual's social world and can impact areas such as school or work attendance, as well as social relationships. Further, this population often reports feeling underinformed and disempowered regarding their condition. While psychosocial interventions exist to address these issues, research suggests that nearly half of all AYA cancer patients feel their concerns in these areas are still not being adequately addressed. This gap in services is often attributed to lack of financial resources, as well as a lack of time on the part of the patient, as well as the medical staff and other caregivers. Given these factors, and given the ubiquity of mobile technology in the lives of AYAs, with nearly 75% reporting access to the internet via mobile technology, there exists the potential to use mobile applications to bridge this perceived shortcoming. Indeed, many such applications already exist and target areas including symptom tracking, assessing quality of life, offering support and feedback, and connecting patients to one another. The problem is that the evidence of their effectiveness and or usability in AYA cancer patients has not yet been thoroughly explored. As such, the current article set out to answer the question, what mobile applications have been identified as potentially helpful to adolescent and young adults diagnosed with cancer and have been published in peer-reviewed journals with findings on their empirical support. After an exhaustive search of the literature, 19 manuscripts were identified based on criteria discussed in detail in the current article. After applying said criteria, 7 published manuscripts were chosen for this review, including 4 smartphone and 2 tablet applications designed for use with AYA cancer patients, as well as 1 general application that included AYA cancer patients in their sample, but who were not the sole target of the study. The applications ultimately reviewed described in detail in this chart. As you can see, those applications found to have clinical utility focused on providing journaling tools, provisioning disease-related information, symptom tracking and assessment, as well as medication planning. The review found that many of these applications adequately address the previously reviewed factors that negatively impact the lives of AYA cancer patients, though none address the need for increased access to social support or behavioral health concerns outside the domain of cancer. Smartphone and tablet applications are growing in number and may provide access to resources to help provide quality of life and address unmet needs of AYAs diagnosed with cancer. This review highlights the promising opportunities available for collaborative research to create and test applications that may benefit AYA cancer patients by assisting them through the medical and psychosocial issues common in their treatment.